We're going to look at the 3 ways of getting off the floor if someone is a paraplegic. So the first one we're going to look at is the side approach. Believe it or not, it looks like the toughest approach, but yet it's the one that most paraplegics will use. It requires a lot of hamstring strength. However, you don't actually need the entire upper extremity to be innervated, whereas the other 2 approaches, you need the entire upper extremity to be innervated. You do need triceps, so you need C7, but after that, you actually can do this. So I have here my patient, and so first thing you have to do is bring your knees up and bring them as close to your body as possible. Now, a lot of times the knees will flop out, and so you have to figure out a way of keeping that knee in, all right? This leg can actually lean against the caster of the chair. Now, the key is to think about positioning. So I think you're a little off in positioning. You want your pelvis to be able to come right up into the chair. So you have to angle. As a therapist, we're looking, what angle is he going to go on to get his pelvis up into the chair? So for now, I'll move it for you. So how you do this is you're going to use this arm here, all right, to push you up. This arm's up on the chair. And then you're going to throw your head down towards the floor and twist on this arm while pushing and pulling with that. All right? I'm going to help you. You ready?
Yep.
It's on. Let's not hit you on this. That's on your count.
1, 2, 3.
Okay. Now he's flopped down. He has to walk himself up his legs, use his arms to reposition. Get his legs positioned well, and he's off to the races. Good. Now we're going to look at the front approach. And with the front approach, it requires less hamstring flexibility than the side approach. However, it does require more strength in the upper extremities. The key is positioning prior to the front approach. When Ethan pulls up into his wheelchair, he wants his knees centered in the middle of the chair. So you have to position well prior, all right? And then he's going to pull himself however he can up into tall kneeling. Remember, it's all arm strength. When he's on his knees, the knees provide a little bit of support because he's lined up, and it's just when you're lined up, you don't need to use muscle so much. And then he's going to push down, do a big dip, clear the chair, and then throw his head down and to the right. One thing you have to do is ask which way you want to turn, and I believe Ethan wants to turn clockwise, all right, to the right. All right, so let's see this happen. And pull yourself up onto the wheelchair. All right, I've seen people use the back of the chair to pull, their chin on the back. I've seen a lot of different things. All right, so what Ethan has to do is do a big dip where he pushes, clears, and throws his head down into the left, and then repositions himself and his legs. The next approach is the back approach. And with the back approach, you have to weigh the risk-benefit. One of the things about the back approach is it requires extensive shoulder flexibility because their arms have to be up and all the way back. And it also requires the upper extremities to be fully innervated. So with the back approach, I often start with the stool because most people don't have the range. And honestly, you don't teach this one as much unless for some reason they really are flexible. You don't want them to hurt their shoulders because then that'll affect their wheelchair propulsion and their quality of life. All right, so starting here, Ethan has to bring his knees as close to his body as possible, and he's in centered with the chair. All right, you get him any closer. Now, if someone has some lower extremity spasticity, this helps when he dips up. All right, if his knees are floppy, like hypotonic, he has to figure out how to keep them and position them so that they'll stay inward to help. All right, then his arms go on the chair or where he can reach. And first it's the dip, it's a big dip, and then it is a head throw forward so that his hips go back into the chair. And I'm going to help from here if he needs it. So first is a dip, then a throw, your head forward and back. Walk yourself up your legs, and he's in the chair.